emergency physician, when asked about the developments that I would like to see in medicine, I would have to say that these can be approached in two ways. Well, there's a preventative aspect and a curative aspect. I would like to see developments in both of these taken, especially in the third world, to a point where we can provide a very good standard of care of medicine. For preventative aspects of medicine, these really are the easiest to achieve, and it would involve social, educational, and behavioral change among not only the general public but also the persons who are leaders in community development and social care, and professionals like the doctors and the other teachers and persons who are influential in how we behave. The primary care benefits really will be the largest in the long term. Now, maybe I should explain a little bit more on what I mean by preventative medicine. Take, for example, the highest mortality from any disease in the Western Hemisphere is mortality due to cardiovascular disease like heart attacks, heart failure, and things like stroke. Now, from a preventative aspect, there are many risk factors which influence how these diseases manifest. Now, the risk factors may be things like diabetes, which can be controlled, hypertension, which can be controlled, inactivity, which can be modified, and then there are some non-modifiable risk factors like, if you have high cholesterol from a genetic point of view, that cannot be really modified by a lifestyle change, but you can control it with medications. And there, if you have a family history of heart disease or strokes, then there's nothing that you can do to change your genetics. But by and large, preventative aspects of medicine I would like to see huge developments in that regard, which can make a major change in medicine really, and longevity. And usually this change can be mostly at the primary care level, where the medical and alternative care practitioners would emphasize the benefits of this type of medicine. Other examples, for example, asthma. If asthmatics monitor their peak flows and monitor risk factors of risk triggers for asthma, then they can control their asthma attacks. So that, just in a nutshell, speaks to preventative aspects of medicine and how I would like to see these develop. The other aspect of medicine really is more curative, and this is more target driven in that you are addressing specific diseases, and it tends to be a lot more costly than the preventative aspect, in that it is mainly focused on secondary and tertiary care medicine, and these are usually research and hospital driven, and consequently more costly to implement and more costly to manage. Case in point, and I make reference again to cardiovascular disease. If you suffer from a heart attack, then you have to be admitted into intensive care or coronary units, where very specialized drugs and specialized monitoring and specialized investigations have to be done. These curative aspects of medicine should be more readily available, and this is a development that I would like to see in the Caribbean region, whereby it's not only those who can afford private care and those who can afford to have the specialist medicines and specialist investigations done. Because remember, if you miss the boat with the disease, heart disease, and complications of same, and if they cannot be addressed at a tertiary or secondary level at least, then it means that we're going to lose a lot more lives when we could have saved those lives. So, curative aspects need to be developed and need to be made more accessible. Now, I understand in a third world country the resources are limited, but I would love to be able to say that this is a development that we can, we can look forward to. Other things like, HIV cure. Of course, everyone would like a cure for HIV. We would like to see, cures for cancers, early screening, early detection of cancers. Those are things that I would like to see as major developments in our region. Really, the aim of medicine really is to achieve a high quality existence on earth, basically high quality living. And there must be a combination of physical, mental, and spiritual well-being. And all advances, be it primary or or curative, must encompass these three interrelated but distinctly different factors.